The technique of static contact is one that will work to establish rapport with the patient, promote relaxation, and assist with pain reduction. When you're using static contact with your patient, it is a motionless contact, so your hands stay in place. It can be performed over the sheets or directly on the skin, and it is considered a dry technique, so you don't need any lotion when you perform this technique. Your hands will rest on your patient, and we're not pushing downwards or applying much of a force. It's primarily just the weight of your hands. Your hand is relaxed and it will contour to the patient's body. Your hands can stay in this position anywhere from 60 seconds up to 15 minutes. When you go to move your hands, make sure it's a gradual release and a gradual contact to ensure that the sedative effects stay in place and it's not jarring for your patient when you go to move your hand. This is a great introductory technique, so when your patient first gets on the table, you can discuss things that you would like to have happen through the treatment. You can teach breathing techniques this way, and it's a great way just to open your treatment in a way that you have a nice, relaxed contact with your patient before you start the treatment. Don't underestimate the power of static contact and what it can do for a relaxation treatment. Notice things like changes in your patient's breathing. You'll notice deeper breaths as they start to relax. Superficial stroking is a gliding technique that is also considered a dry technique. There is no lotion required for this. It can be performed over the sheets or in direct contact with the skin. To perform superficial stroking, you can use the palmar surface of your hand to have a more relaxing effect. Or if you switch to fingertips, it has a slightly more stimulating or awakening effect. The rate, so the speed, and the duration with which this technique is applied will determine whether it is relaxing and sedative in effect, or if it's more stimulating or arousing, like if your patient has fallen asleep on the table and you're trying to wake them up. If you go at a slow rate, contact with the palmar surface, and in one direction, it will have a sedative effect. As you get to the end of the stroke, you're going to pick your hand up, place it down gently to start again. If my patient has fallen asleep and I look to wake them up, if I need to change position, I can switch to something fingertip a little bit quicker, and it can go in many directions to wake them back up. The technique of fine vibrations can be used to achieve pain relief and to produce changes in neuromuscular tone, so it can decrease tension in the muscle. There are two types of fine vibrations. We can do a static vibration where it's just in one spot, or we can do a running vibration where there is some gliding on the skin as we perform the vibration technique. Oftentimes, therapists are unable to oscillate at the same rate between their dominant and non-dominant hand. So most therapists will choose to oscillate just with their dominant hand. If you choose to use both, slow down the rate of oscillation with your dominant hand to match your non-dominant hand to ensure that the sedative effects stay consistent. I'll show you a static fine vibration first. This is a non-gliding technique. I'm using my hand and wrist to create the majority of the motion. And it is a dry technique, so I don't use any lotion on the patient's skin. I can pick up my hand, move to the next area, and perform the fine vibration there. The vibration should be not very visible to the eye. They're just tiny vibrations. If I wanted to do a running vibration, I would start in one part of the body, start my vibration, and then very slowly and gently glide along the skin as I perform the fine vibration.